Hi, my name is Camille Lambert. I have a doctorate in physical therapy and I've been practicing vestibular rehab for almost 20 years. Vestibular rehab is treatments for dizziness and imbalance. And what I want to talk about today is a common problem that a lot of people have and aren't even aware of. And that is loss of vestibular function in either the right or the left ear. A lot of people know about the problems with having crystals in the inner ear that are out. This is something different. And I want to be sure people know about this because there is good help available. So, what I'm talking about is the loss of vestibular function. And to explain what the vestibular system is, I'm going to point here. This is a cross section through the head. So if we cut through my head right here and looked inside, this is what we would see. The ear canal, this is where earwax lives, the bones of the middle ear, and this little thing here is the vestibular system. And I will zoom in so that you can see it larger here. So if you know what a gyroscope is, you have a shortcut already to understanding what the vestibular system is. It's our organ of balance, and we all have one on the right and one on the left side. And it's made up of 3 loops, one that's up, one that's sideways, and one that's back. And there's fluid in each of those loops. So when you move your head, it makes the fluid move depending on which way you're going in a different loop. And your brain uses this information, okay, my head's going back, sideways, whatever it's doing, it uses that information for balance. It also coordinates that information with your eyes. So if you move your head fast, you don't have to think, move my eyes at an equal and opposite velocity to my head movement. It just happens automatically. Well, what can happen is people can lose function of the vestibular system on either the right or the left side. And now, when they move their head, the signals going to the brain don't match up. And it causes a dizzy sensation. Or side to side, same thing. The signals don't match up and it causes a dizzy sensation. And what I would like to make clear is that there's treatment for this that's very effective. The prognosis is quite good. Most people in 4 to 6 weeks, their dizziness is 80 to 90% better. What therapy involves, you need someone with experience in vestibular rehab, and you learn exercises to compensate for the loss of vestibular function on either the right or left side. So over time, your brain learns to compensate for this discrepancy in messages it's getting from the right and left ear. And the dizziness gets gradually better and better and better. And most people go close to 100% to normal, if not 100%. So the next question is, how do you know if this is your problem? Common symptoms are dizziness when you're moving your head. So this would be bending down to get something, reaching up to get something overhead, turning quickly, walking and moving the head. Walking in the grocery store is really a hard thing for a lot of people with this problem. They get very dizzy as they walk around and move their head. I also frequently hear from people that they have trouble walking in a straight line. They think they're going straight and they realize they're veering off to the left or the right. Additionally, people frequently have problems with their balance, and this can vary from very mild to quite severe. So what the takeaway is I'd like you to know about this common problem, to know that it is treatable, and please check out our website or give us a call because we are here to help. Thank you very much for listening.